Now, from the News Channel 5 network, this is Medical Mondays.
Good evening, everyone, and thank you so much for joining us. I'm Carrie Sharp here tonight for Medical Monday with a topic that I know affects so many of you at home, and I think that we have some encouraging news to share with you tonight. We're going to be talking about arthritis tonight on Medical Mondays, and I have Dr. Deaver Collins here with me, a rheumatologist. Thank you for being here. Good evening to you.
Thank you.
You have your own practice near St. Thomas Midtown.
I do.
Right near downtown. Been doing this job for well over 30 years. Very knowledgeable in this, so I want to encourage people, if you have a question about arthritis, tonight is your chance to get some help, some free advice. I know that's always welcome. So go ahead and give us a call. The number is on the screen. 615-737-PLUS is the number to call right now. We will get you lined up, and as always, we will try to take as many calls tonight as possible. As we do that, Dr. Collins, I want to talk about arthritis. There are a lot of different names for this. There are different types of arthritis. Let's just start with the big picture. What is arthritis?
Arthritis really means disease of joints. So a lot of people think of that as just being joint disease, and that word does mean joint disease. It is true that patients who have some forms, such as rheumatoid, have problems in other areas of their body, but at its basis, it's basically joint disease.
And this is a chronic illness.
Well, not always, actually,
Okay.
thank goodness. For instance, juvenile arthritis, now known as juvenile idiopathic arthritis, is basically rheumatoid arthritis of the young, and that can start in a 1-year-old.
Wow.
Or a 6, or anyone over up to the age of 18, of course. And we see a fair amount of that. Now, those children may actually get well as they grow out of childhood. We don't wait for them to get well on their own. We try and help them along. But that is one form of arthritis that can actually get better. Most of the other forms of arthritis are chronic, and in that sense we can't cure them, but we can put them in remission, which means the person's not feeling it.
And that's a question I asked before the show, because I mean, I remember my grandmother who dealt with terrible arthritis. She was just always in pain, and you see people with the big knuckles and the sore joints, and they're just living in pain. You said that doesn't necessarily have to be the case anymore.
It really doesn't. Now, I want to specify that at the outset that we can't at this point stop osteoarthritis, which is the wear and tear kind, and what many people in their 60s or 70s may have a hip replacement for, or a knee replacement for. And it's the kind, frankly, that many people think of as something that his or her grandmother had, with sort of big knuckles out here at the ends of the fingers. We would like to be able to stop that disease, but right now we're just treating the symptoms. Fortunately, that age-related form of arthritis is slow to progress, and it's livable with some help.
And we're going to dive into each kind, because rheumatoid arthritis, you have some better news on.
I do.
Yeah.
I have some great news. So I think the thing that we really wanted to try to do, and we as a profession 30, 40 years ago, was do something about the diseases which were affecting the younger patients. Rheumatoid starts in the 20s and 30s most of the time. So it's a young person's disease, and it's affecting a young professional or a young mother, someone who's really at the prime of his or her life. And so 40 years ago, frankly, we weren't doing a very good job at slowing that disease down. Well, after about 1985, and then really going through the late 90s, that's completely changed. And the risk of damage is way down. We can put it in remission, which means no swelling, no tender joints, less than 15 minutes of morning stiffness.
That means living life.
That means living life.
Yeah.
And working when desired. And that's pretty gratifying. And that outcome also applies to the children who are sick enough with juvenile arthritis to need help. It used to be that those children often receive something called corticosteroids, which is prednisone, an anti-inflammatory hormone which works for inflammation but has a lot of side effects.
Yeah.
Well, being able to treat those children and put them in remission without using steroids has really been a great thing in the last 20 years.
That is huge. As suspected, I knew we'd get phone calls right away. So let's jump to the lines. Terry, thank you for joining us this evening. What's your question?
Yes, ma'am. Ma'am, I got a question. Sometimes I get cramps, and I can't straighten my fingers out. I don't know if it's a sign of arthritis or what. I mean, is that a sign of arthritis?
Let's see what Dr. Collins has to say.
Well, if the finger sticks in the palm and then has to be pulled back out, that's called a trigger finger, and it's actually a problem with the tendon in the palm sticking. There's a little pulley right there, and the tendon runs back and forth under the pulley, and it simply sticks under the pulley. A muscle cramp would pull a finger down, and it would stay there, and the muscle in the forearm would be tight. Neither one of those usually is actually a form of arthritis. That usually involves either the muscle or the tendon, which moves the finger.
All right, well, good to answer that. Terry, hopefully that gives you your answer. I don't know if it gets you out of those cramps, though, but hopefully you can start searching in another direction. Thank you for calling in. Carl is also on the line with us this evening. Good evening, Carl.
Hello?
Hi there. Go ahead with your question.
Yes, my name's Carl. I live up here in Springfield. I've been kind of hard on my joints my whole life, and I've had arthritis in my fingers mostly, but my knee has been giving me fits, my right one more than my left one, and I just ain't sure what really to do about it.
Okay, let's start there. Great question.
Right.
What can you do when you start feeling these aches and pains and the suspicion of I have arthritis?
Right, well, if you have a joint that's continuing to hurt, I think the first thing to do is to get some help getting a diagnosis. Now, if it's simply a knee joint in a fellow who sounds pretty young there, I think it's important to remember that even if it's the wear and tear kind of arthritis or the arthritic knee in a former football player, because they get very early osteoarthritis, you know, if it's an osteoarthritis knee in a very young person, one isn't going to want to replace that joint. But one would like to see what can one do to keep that joint functional and less painful. Usually a simple x-ray, it usually doesn't require a fancy scan or an MRI, would tell your doctor whether that's osteoarthritis or not. And
What
allow
are you going to see on that x-ray? What will it show if there is arthritis? What does it look like?
So for the osteoarthritic knee, there actually are bone spurs that are formed. So the body's trying to react to the damaged cartilage, which is no longer smooth. It looks like gravel road in there, and the bone will form lips out to the side, which are easily seen. And in some cases, if it's just cartilage damage, it may require an MRI scan to show that. Now, the scans don't, of course, fix the pain, but it's important for the doctor to analyze the joint by physical exam, take a history. For instance, osteoarthritis is usually most painful later in the day. It's not going to, it may be a little stiff and achy in the morning, but that may last 5 or 10 minutes. And then later in the day, especially after a hard day of work, someone's going to say, my knee is killing me, you know, where's the aspirin bottle? That's more likely to be an osteoarthritis problem. And there may be a pretty simple way of helping that patient feel better.
Well, what do you do?
Well, the anti-inflammatory medicines help. Tylenol, which isn't thought of as much of a medicine anymore, is actually pretty helpful. There are some medicines that can be put on the surface of the knee. There are some liquid cartilage preparations which can be injected into the knee and provide pain relief for up to 6 months. It's not very popular to hear about this, but the fact is that patients who have some extra weight, if they're able to shed 20 pounds, will feel significantly less pain. And last but not least, in fact, more importantly at the beginning, changing the way activities are performed is very important. And exercises that are lower impact are much easier on the knee. The surgeons oftentimes have people riding bicycles, stationary bicycles, right up until before a knee replacement.
Oh, wow.
Because the weight is on the seat, not on the knees. So patients are able to get aerobic exercise, strengthen their thighs and their legs without damaging the knee joint.
Yeah, makes sense.
Yeah.
Okay.
Helps a lot.
We have a lot of callers on the line with Angela and Tammy and Kay. We're going to get to those right after this break, so stay where you are. If you have a question about arthritis, go ahead and give us a call, 615-737-PLUS. We'll be right back.
lot of change in Nashville over 40 years of marriage. One thing we never gave much thought to changing was our vision. When our cataracts developed, we had to give up the simple things we'd taken for granted. Seeing to put my makeup on without my glasses, just going out for dinner. Now, thanks to the laser cataract surgery we had at Loden Vision Centers, we can even take those nighttime drives like we did when we were younger.
If you want to shed the fat and sculpt your core to get those sexy toned abs of your dreams, then stop doing sit-ups.
Say what?
And start dancing with Hip Hop Abs, the fun new ab sculpting system from Insanity creator Sean T.
I don't want you to ever get down on the floor to do crunches again. I'm gonna break it down so you burn the fat and sculpt those abs fast.
Just do Sean's easy to follow moves to work your upper abs, middle abs, lower abs, and obliques, all while you're dancing.
I went from a size 18 to a size 2. I have abs now. I've got a six-pack.
And now the complete $80 Hip Hop Abs system is 75% off. That's right, Hip Hop Abs is only $19.95. We'll even upgrade you to express shipping free. Get the complete Hip Hop Abs system for only $19.95.
Call 1-800-339-1045 or order online at gethiphopabs.com. That's 1-800-339-1045. Call now.
Chew on this. Mario Batali's up to a little hinky-panky in my kitchen.
It's almost like making the ground beef fondue.
Oh my God.
Exactly.
And bonus, I got a winner drunken chicken dinner. It's ridiculous. Plus the timeless transparent star, Judith Light.
The girl from One Life to Live. No, she's from Who's the Boss. No, she's from Ugly Betty.
Next, Rachel.
Tomorrow morning at 9 on News Channel 5.
You can tell a lot about a person by the way they dance.
Hot.
You people be freaks.
That's New Ellen, this little dancer. And Claire Danes brings the club to us.
Last time I went, it was like fetish weekend. Everybody's in black or nothing at all.
Back up. People are dancing completely naked?
Yes.
Gorgeous.
It is disgusting.
Tomorrow at 3 on News Channel 5.
Every year, tens of thousands of young people experience homelessness. If you or someone you know needs help, 1-800-RUNAWAY can provide support and connect you to the right resources. Together, we can end youth homelessness.
Welcome back to Medical Monday. I have Dr. Deaver Collins here with me, a rheumatologist, to talk about arthritis. So if you have a question about arthritis, right now is the time to call. 615-737-PLUS is the number to call. That number right up on the screen right now. Thank you very much to our producer for doing that. Let's jump to the lines. I like to get your phone calls just as quickly as we can. Tammy is on the line with us. Tammy, good evening to you.
Hi.
Hi there. What's your question tonight?
Okay. I had juvenile osteoarthritis. And about 5 years ago, when they first looked at my back, the doctor told me that it looked like a 75-year-old woman's when they got to do the fluoroscopy procedures. And so now that I'm 46, it's pretty far advanced since I've had it for so long now. I do deep tissue sports therapy, massage, and my massage table is actually on the floor now because I can no longer work standing up. But they sent me to the surgeon. They said it was the nerve damage in, I guess, from T5 all the way down my coccyx. It's too far gone, and I'm not a candidate for surgery. And I just wanted, he's not a rheumatologist, but I just wanted to see if you had more information than what I've been getting.
Okay. Dr. Collins, what do you think?
Well, this is one of the biggest challenges we face. Basically, we're talking about a situation where someone has two problems. She started out with an inflammatory disease at a younger age, before the age of 18. And now, several years later, and also working in an occupation that I think I heard massage table.
Therapist, yes.
So she's bending over all the time, so all of her weight is on her spine. Then she's had an occupation that's a little bit hard on the spine as well. And now she's having continuous pain and has been told that there's a lot of damage. So if, just hypothetically speaking, if we were back with a 15-year-old, our goal would be to control the inflammatory disease and prevent damage. There isn't a medicine available right now that will take away or dissolve bone spurs which have formed in the spine. So if this young lady has bone spurs in her back which have formed because of her arthritis as well as her occupation, then that ends up being pretty much of a pain management challenge. I think the key thing that I would want to know on her behalf is that there is nothing about her disease which is still inflammatory, because the juvenile arthritis patients may climb out of it, but there are a number of our patients who still have arthritis as adults. So they started having arthritis at the age of 8 or 9 or 10 or 15, and they're at the age of 45 and they still have arthritis.
Wow.
Active inflammatory arthritis being treated as adult rheumatoid. Now, what we're hearing about on the phone here sounds like there was a lot of damage, in which case it's going to be a question of managing her symptoms.
So if Tammy were to come into your office and telling you what she's already told you, what would you do? Would you start taking x-rays and just seeing where she is? What happens then?
I would start by asking her questions. I would be very interested, for instance, in whether inflammatory back pain has characteristics. It's always worst in the morning. There's an hour of morning stiffness. It tends to get better with exercise. It does not respond to rest. It's often present at nighttime. So there are ways that inflammatory back pain acts, whereas the wear and tear arthritis is going to be stiff and painful for 5 or 10 minutes in the morning, be worse later in the day. After she's been trying to do massages all day, she's going to hurt a lot later in the day.
Okay.
I would start with a history, examine her, look at her ranges of motion, and then do x-rays and some lab tests for inflammation.
Okay. Tammy, just so you know, we're going to put up Dr. Collins' number and a way to get into him throughout the newscast. So not newscast, but throughout Medical Monday. So stay tuned, get a pen and paper ready, and we'll give you that information if you're interested in that. We got lots of callers to get to. I have Kay on the line. Kay, thank you for being with us. What's your question?
Yes, I've been diagnosed with osteo and rheumatoid arthritis, and presently methotrexate has been the drug of choice, and I'm having difficulty now with my thumb. Sometimes it's a pain, and I can't hardly use a pen sometimes, or like grasp a doorknob. And so I'm concerned about, is there a more effective approach than methotrexate, and are there foods that you should not eat if you're in this situation?
What a great question. Okay, Kay, I'm going to put you on hold to listen to your TV. Your thoughts?
All right. Well, methotrexate is a 60-year-old drug, and it is the best of the traditional therapies for rheumatoid, believe it or not, for the last 30 years.
Wow.
And it does a good job in preventing damage. But still, it doesn't work for every patient. And in comes the history with the biologic treatments, which really became available about 20 years ago. So, not talking about the specific treatment for this patient, but in general, yes. For a patient who has failed to respond well enough to methotrexate, there are other options. But the second point about the thumb is that the thumb is what allows us to grasp, and the joint at the base of the thumb frequently wears out from osteoarthritis. She said that she had two diseases, and many adults who are middle-aged and a little older have both kinds of arthritis. So it may be that her thumb is painful not because of rheumatoid, but because of her osteoarthritis. The management of that's going to be far simpler. She doesn't have to abandon her methotrexate if that's what her rheumatologist advises, and there may be some simpler measures that can be done to take care of that thumb.
Okay, so she just needs to get into her doctor and really have a good conversation about this.
She does. And the food question...
Oh yeah, let's get to that. That was a great question.
Right, so a long time ago I was handed a study of milk from special cows for rheumatoid arthritis, and that didn't work. Neither does any diet I've ever seen since. There are a lot of thoughts and theories, and there certainly are patients who have special problems such as true gluten sensitivity, who have different kinds of joint issues. But as of this point, there is not a diet that will fix rheumatoid, Contrary to what some folks may think, if we rheumatologists had diets that we could administer that would take care of these diseases rather than medications, we would jump on the bandwagon.
Yeah. But you're just not seeing it.
It's not ready for prime time yet. I think the work with the biodome and the internal environment in the intestinal tract may well provide a lot of new thoughts in coming years.
For a lot of different things.
For a lot of different things.
All right. Okay, Angela is on the line. Angela, good evening. Thank you for being with us. What's your question?
Yeah, I have my hands swell up and got knots on them, and my feet swell up and they turn purple. I was wondering if that was arthritis.
Okay. Dr. Collins, what do you think?
All right. Well, the purple color is not characteristic of simple arthritis. There are diseases such as lupus and some other related illnesses which are also seen by rheumatologists, which are so-called autoimmune conditions that involve a lot of abnormal lab tests and can cause purple hands and feet. My first reaction to that was that this young lady should definitely seek the attention of her primary care physician and quite possibly a rheumatology consultation because of that purple color. That means that the circulation to her hands and feet is not normal. It is also true that swelling goes along with some of those same conditions. Arthritis swelling that is from inflammation is going to be there when someone wakes up in the morning. So in general, if one's saying, well, my foot swells, my first question is it swollen at 6 o'clock in the evening or 6 o'clock in the morning? If the foot's swollen at 6 o'clock in the morning, it's probably inflammatory arthritis.
Okay, so start with the primary care physician.
Yes.
Then you may need to move on. And we were talking during the break, and you had brought up a great point. Our primary care physicians do an awesome job. They have to look at a lot of things in a short amount of time. So sometimes you need to seek out that specialist. And you said especially for gout.
Yes. Well, the thing about gout is that people think of it as just, oh, gout.
Right.
You know, my toe hurt and now it doesn't hurt anymore.
Right.
But the problem with gout is that even between attacks of a very painful toe, the damage is going on down there. And so gout will actually tear up a joint as badly as rheumatoid will.
Wow.
It won't tear up as many, but it will destroy them. And so that's really preventable with aggressive control of the uric acid level.
So explain what gout is. I think a lot of us have heard of it, but we really don't know what it is.
Well, the name means drop, and it refers to as if someone were dropping acid on one's foot. It feels like acid's being dropped on the foot, but it's basically an overproduction of uric acid, which is a waste product, and the body doesn't get rid of it over time. So it collects all around the joints, and then from time to time, it forms little needle-shaped crystals, which literally look like a sewing needle under the microscope. And we see those in joint fluid, and they start, the white blood cells try to eat the crystals. Literally, the crystal sticks through the white blood cell, and it's a 5-alarm fire in that joint when that happens.
Yeah, my husband's had it, and it's terribly painful, terribly
terribly painful.
So what do you do?
Well, first of all, there are patients who just have an attack every 10 years, and they really don't need to be on a lot of medicine long term. But the first thing we do is when someone has an attack, we make sure they're on preventative medicine to prevent another attack for 3 months. That's simple, but it's not often done because that risk is very high for 3 months. If someone has had 3 or more attacks in 12 months, then they need to be worked up and treated long term. Those patients can be put in remission, which means no attacks and no damage, within 6 to 9 months, every time. Well, 99% of the time. I mean, there are a few who are difficult, but.
Yeah, okay, well, some good information there. On that, we have to take another quick break. We've got callers lined up, so we're gonna get to those calls right after the break. Stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Sunshine, blue skies, and highs soaring into the low 80s today. You think Mother Nature got the hint that it was spring? Officially now spring, and right on time. We've got warmth, and where we've got warmth, we've got a chance for storms too. Overnight tonight, we're down to 60. Chance for some isolated showers around daybreak, but your better opportunity for thunderstorms will be Tuesday afternoon, mainly southwest of Nashville. We could see some hail with some of these thunderstorms, not expecting widespread severe weather, but it is a possibility, so you should plan for that. If you can park your car in a covered spot, that'd be your safest bet for Tuesday. Temperatures will drop behind this. This is a cold front that's coming through, so the warmth today won't be here by the time we get to Wednesday, although it won't be too terribly cold. Here's a look at current conditions in Nashville. Tonight we drop down to 60, 73 degrees tomorrow with breezy conditions ahead of the showers and storms that will come through in the evening. A few lingering showers Wednesday morning with widespread storms expected during the weekend.
We have this crazy thing going on today. I was just walking by and all these DJs and producers are set up all around the city.
I just walked by and I said, "What's happening, guys?" And they told me they were making music.
It's the way you walk, it's the way you talk.
There were a lot of people that claimed they had no musical talent and then sat down and kind of made some really nice sounds.
I like this music.
Feel amped about today, inspired musically, about life.
They said I could play, so any chance to play at all. You know, that's my life. I love music.
Yeah, I saw do it.
Welcome back to Medical Monday. We are talking about arthritis, and boy, have we gotten a lot of phone calls. Thank you for calling in. We're going to try to get to these questions just as quickly as we can. I have Dr. Deaver Collins here with me, a rheumatologist, answering all these questions. And let's just jump right to it, shall we? Let's get to, who do we have on two here? Dottie, Miss Dottie, thank you for calling in. What's your question?
My question is, I just had, I have arthritis in my right hip. And I had surgery about a year ago, and it's still really, my question is, it's really hurting, and I can't stop the pain, and every time if I walk or I hit something, it pops back out.
Oh.
And I was wondering if there's anything that I could do to stop the pain so much.
Well, that's a tough one because now we're not talking about a human joint anymore. We've got metal and plastic in there. Yeah. And that's known, of course, as a painful total hip is the term of art. So a painful artificial joint, which is primarily painful when walking. Of course, the good news is that doesn't sound like it's infected. One of our concerns about pain in a metal joint is late infection, which presents with fever, and that's a very serious medical problem. But if primarily it's a question of walk pain, that sounds like there's a mechanical problem, just like there would be with a car that's got a bad wheel. Yeah. And there may be a problem with the prosthesis or how it fits. The answer for what to do about that is to get to a surgeon who has experience, maybe the surgeon who put it in, or someone who has experience with complicated redos of artificial hips. And there are a number of surgeons who specialize in dealing with artificial joints which are no longer functioning as well.
And we have some in our area.
We certainly do.
Okay, so you need to ask around, get some referrals,
That's right.
Find the right person to go to. Okay, let's get to, we also have Dot on the line. Hi, Dot. Hi, what's your question?
My hands and fingers already twisted and knotted. They're already crippled. And I haven't been diagnosed with rheumatoid arthritis, but that's what I've always called it because that's what my mother had, and she was worse than me and suffered very bad. And she was on the older medications, and they claimed that they damaged her heart, and she passed away. And I've never been, no doctor has ever told me that I need medication, but I really don't. I'm afraid to take it because of the side effects I've heard so much about. And my feet are getting like this, and stiffness and back and so forth. But my hands just look terrible and feel terrible.
Well, Dot, go ahead and hang up, and I want you to listen to your TV. This is a really good question because I understand that fear. And you were telling me so much has changed in the way you treat arthritis now in the past 30 years. So it may be different from what her mom experienced, right?
Well, it is, but I think it really reminds me of something a person I think of as very wise in Dallas and I were talking about this, a rheumatologist I work with a lot, and his comment was, I think this actually may be a quotation from a movie, and I don't remember which, but that when you're worried about getting hit by a train, it's the engine that will kill you. It's not the caboose. The caboose is the one chance in 1,000 of one of those side effects, and the engine is the arthritis. So in fact, most of the things that people worry about most with these strong rheumatology medications, which are advertised on television and have these terrible sounding lists of side effects, the really bad things happen to 1 person in 1,000, 1 person in 5,000. Well, there is more than a 50-50 chance that a patient with rheumatoid arthritis is going to have terrible damage. That's 1 chance in 2. That can be prevented. So it's our feeling that if one takes really the chances of an uncommon problem over here in the side effect pile, and what happens if we don't treat arthritis over here, it's pretty obvious which choice any one of us would make for ourselves or our own families. As far as Dot's concerned, I think the really question that a rheumatologist perhaps is going to need to answer is how much of the changes in her hands are permanent, because as I said earlier, we cannot put Humpty Dumpty back together again with a pill or a shot. I mean, there are surgeries for those things, but that's someone else's area of expertise. On the other hand, if she still has active rheumatoid, there isn't a time when it's too late. We have excellent work showing that, for instance, methotrexate, which we discussed earlier, is just as safe and effective when used by a rheumatologist in someone in his or her 80s as it is in someone who is in their 50s.
Wow. And you said with the rheumatoid, the goal is remission. That's right. I mean, that's a big statement.
That's
remission.
a big statement.
Yeah.
And we have the outcomes data to show for it. If remission and low disease activity are defined by numerical measures from questions we ask in the clinic. My patients get tired of answering the same questions every time, but for us, they get turned into a score. And as does how many joints are tender, how many joints are swollen. And if those scores are low enough, we can say those patients are going to be able to work, they're not going to have damage, and they're going to be able to live their lives.
Yeah, that is good. Let's jump to Helen. She's on the line waiting ever so patiently. Helen, thank you for being with us. What's your question? Well, maybe she's not waiting so patiently. Okay, we'll put you on hold, Helen. Stay where you are. We'll get to you. Barbara's on with us. Hello, Barbara.
Hi, I'm still here.
Okay, good. Thank you for waiting. What's your question?
My question is, could he give us some information on psoriatic arthritis?
I'm so glad you brought that up because we hadn't gotten to that yet. Tell me about psoriatic arthritis.
Well, psoriatic arthritis has a name that only someone who has it knows how to pronounce it. But it stands for psoriasis and arthritis.
Okay.
So psoriatic arthritis is so named because most of the patients have the typical psoriasis type rash. It may be hidden someplace, like below the hairline in the back. My hairline is not so hard to see, but yours would be very hard to see. So sometimes the rash isn't even visible to the patient. And I will occasionally find a little patch about that big someplace, and the patient wasn't even aware.
Wow.
The arthritis is an inflammatory disease that acts very much like rheumatoid, but it involves different joints. It tends to involve like one knuckle here and one knuckle over here. It's not quite as symmetrical, like rheumatoid will go here, 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 and the same joints on this side. Also, psoriatic can go in the spine, which rheumatoid will not.
So what do you do for psoriatic arthritis?
The same regimens that we have that work so well for rheumatoid work for psoriatic. Plus there are a few extra biologics which are used as well.
And does it also take care of the rash? I know for some people who have that, it's really bothersome to them.
And yes, it does. In fact, the the FDA-approved indications of each of those medications for the skin rash is a separate indication. So the medicines had to be tried for the rash and then tried for the arthritis in separate tests, in separate studies.
Interesting. All right. Hope that answers your question. Let's go back to Helen here. Helen, thank you for being with us. What's your question? Helen? Oh, shoot. We're having trouble getting Helen. Okay, we'll keep her in the lineup here. Let's see if we can get to Nancy. Nancy, are you with us?
Yes.
What's your question tonight?
Okay, my doctor tells me that I probably have arthritis in my shoulders, which that's where I have my pain. Now, do I use heat or ice?
Well, all we know right now is that her shoulders hurt.
Yes.
And that there may be something wrong with her joints. So I'm just going to talk about heat and ice in general terms.
Okay.
Ice is a more effective anesthetic, and heat is better for stiffness. So if the chief problem is pain, use ice at least first. If people are both in pain and stiff, we in general say, well, use the ice first and then the heat. Sometimes physical therapists will reverse that order, and I certainly highly respect and frequently request consultation from physical therapists, but that's what I would do for that particular set of complaints.
Okay, very good. And then maybe if let me ask you this question before I suggest anything. If you suspect arthritis, is it better if you catch it sooner? Does it make a difference in the outcome later on, or is it just whenever you decide you've had enough, you can find some relief?
I'm glad you asked that question.
Okay,
I should have suggested that you asked it. It's so important. So the answer depends on whether it's inflammatory or not.
Okay.
Back to the idea of morning pain and morning stiffness being inflammatory, joint swelling, loss of range of motion, but that also applies to the spinal arthritis that's inflammatory. I saw a 15-year-old young woman today who's been treated for bulging discs for about 3 years. In fact, when she hurts is when she gets out of bed in the morning. She is very stiff in this morning, and her spine does not move well at all at the age of 15. So that's a different pattern of pain. The inflammatory disease is so important to get to early that the new guidelines specifically carve out patients who have had arthritis for less than 6 months and say, jump on that right then, rheumatologist. And that's what we do.
Okay, very good to know. Okay, I'm told Dottie is on the line. Miss Dottie, are you there? I mean, Helen, I'm sorry, now I'm confusing you. Helen, are you with us?
Yes, I'm here.
Yay. Okay, go ahead with your question. I'm glad we got you tonight.
Okay, like I said, I was diagnosed with RA about 5 years ago or so, and unfortunately I had problems with the car and it blew up, so I had no way to get out of town to see a rheumatologist because there's not one here where I'm located. But I recently was checked again by my family physician with the RA, and she said it was negative. And I'm just wondering if that's possible for one to be positive and one not be. And I would like to know if there's any other test to, see if I do actually still have it.
Okay.
So that way it can be treated, because I do have a lot of problems with my fingers and feet, like pulling in and cramping and this and that. So.
Okay, Helen, go ahead, listen to your TV. I'm going to put you on hold so we can get that answer. All right, so a difference in test. Does that make sense?
Well, it does make sense in that what we're talking about is an antibody, and antibodies to anything go up and down in the bloodstream. The first message is that a positive blood test does not make a diagnosis of rheumatoid. And rheumatoid arthritis does not require a positive blood test. We are so concentrated on test results that sometimes that gets lost in the wash. Up to 1 in 5 of my patients with rheumatoid and worldwide has completely negative lab tests. That's answer one. Answer two, there is another more specific lab test for rheumatoid called CCP. These antibodies sound like alphabet soup, so not going into the name, but there are some other lab tests most important is her history and physical exam. So if there remains a question about it, she's interested in getting this seen about, it's certainly not too late to get on medicine that will control the rheumatoid arthritis if she has it. The blood test being negative should not change that plan.
And that's when you maybe need to take it beyond your primary care doctor, right? Because they aren't specialized in this area, and that's obviously what a rheumatologist does. Okay, we have Joe and Judy both on the line. We're going to get some more calls lined up. Stay where you are. We're coming right back with Medical Monday.
This week on Fishin' Affliction TV.
Come on, big dog. Tell me, how's that feel to you?
Join Team Fishin' Affliction for part 2 of Fishin' the Big O as they're fishing legendary Lake Okeechobee.
Come on. Big dog, you made the call, man. That man.
Your Fishin' Affliction TV weekend begins Saturdays right here on News Channel 5 Plus, your home for
Fishin' Affliction time for those who've got it bad.
Tennessee, one of the most innovative and modern states for healthcare in the nation. At United Health Group, we're honored to provide high-quality care to more than 1 million Tennesseans and to equip doctors and nurses with data and insights that can help prevent and treat illness. More than 3,000 of us live here, serving our communities every day. Tennessee doesn't shy away from tough healthcare challenges, and neither do we. United Health Group, built for better health.
Call Bart Durham Injury Law at 242-9000 because you deserve to be paid for what you've gone through.
She stands in the face of evil and will not lose hope or faith. America, the land of freedom, is still the home of the brave. So raise the banner, call no glory. Let us join our fellow man. History will write the story. America will always stand. History will write the story. America will always stand.
This is your view every morning. Sky 5 rises and shines just like you do. To get to the news you need faster than anyone else. The only full-time morning news helicopter. Sky 5 is a difference you can see every morning. Only on News Channel 5.
Welcome back to Medical Monday. We are talking about arthritis, getting lots of calls, and we're going to get right to the phone lines. We have Joe on the line. Joe, thank you for hanging in there. What's your question tonight?
Yes, I've got a finger, the one that's next to my thumb, and it's been sore for about 6 months, and it's at the base of the finger next to the hand. And I've noticed here the last month or two, my other finger on the other side, the same one, is sore. And what my question is it some kind of arthritis? It sounds like some of the symptoms he's describing is still up in the morning, but there's very little swelling, and it only hurts when I move them. But it's sore all day and sore at night, about the same. I'll hang up and let him answer.
Okay, thank you, Joe, for calling in tonight. Well, that certainly is a pain. Have sore fingers anytime you move them.
Anytime you move them, day and night.
No fun.
Joe has rheumatoid.
Ah, how do you know
likely.
that?
So I just made a diagnosis without seeing the patient, which I really can't do.
Right.
But I was to make the point that He had small joint symptoms that were inflammatory, and it's symmetrical. Same joint on both sides of the body, literally that knuckle for 6 months, then in the past month, this knuckle.
And
Boom.
that's mimic.
Or it may have been left and right. So it's completely symmetrical, mimicking on the same side of the body. Gout doesn't do that. It doesn't stay around. And osteoarthritis doesn't go in that joint in general, except in rare circumstances, and it wouldn't cause that morning stiffness.
Okay.
So in general, it is likely that this gentleman has inflammation in those joints. That means inflammatory arthritis, and the most common cause of that is rheumatoid arthritis.
Okay, so he needs to get to a rheumatologist.
Yes.
And then get some treatment.
Yes.
Okay, good deal. Joe, I hope you can do that. Let's jump to Judy. Judy, what's your question tonight? Thanks for being with us, by the way.
I'm glad to hear it. A few years ago, I heard on the news that if a person had rheumatoid arthritis, they would not get Alzheimer's disease. I'm wondering if there's research being done on this and if this is true.
That's interesting. Anything to that?
Not to my knowledge.
Okay.
I wouldn't want to test that hypothesis by saying, let's figure out a way to get rheumatoid to keep away Alzheimer's. Seriously, though, in answer to do justice to the question, inflammation in general is bad for the body as a whole. So you and I were talking earlier about the fact that prior to modern treatments, patients with rheumatoid arthritis frequently had heart attacks earlier than usual. They may have had problems with the circulation to their brains earlier than usual. And the aggressive treatment of rheumatoid has actually pushed that back.
Wow.
So we are having fewer problems with heart attacks in patients who are treated aggressively for their arthritis. So the arthritis caused stress in the brain, as best we know, and certainly there are some forms of arthritis that actually attack the brain. I'm not familiar with the research about Alzheimer's and rheumatoid, but I would be skeptical that having rheumatoid protects other organ systems.
Yeah, interesting. Okay, let's go to Betsy now. Betsy's on the line. Thank you for being with us, Betsy. What's your question?
Good evening.
Good evening.
I, years ago, was diagnosed with, or so I thought, rheumatoid arthritis, but now they're saying it's osteoarthritis. And I've had x-rays, yada, blah, blah, blah. But my question is, my hands hurt 24/7, and I can't even straighten out my fingers. They're completely shriveled. I'm still trying to work and keep my normal routine, but it's hard to do anything anymore. I mean, anything.
Yeah.
And, you take for granted the little things that you used to be able to do, you can't do anymore.
Sure.
My question is, my hands, they hurt all the time. They never stop hurting. The tingling, and I've told my doctor this, the tingling never stops hurting. It feels like someone is just, are you there?
Yes, we are. Go ahead.
It feels like, I heard my dog barking. It feels like someone is like just slicing my fingers with razor blades. I mean, that's how much it hurts.
Yeah.
And now it's going into my knees, and my feet are tingling. And I don't go back to the doctor for another month, but she's trying to send me to a specialist to see if there's anything they can do about my hands. One of my hands, my left hand, wasn't like this a couple of months ago, and now it's almost got up with my right hand.
All right, well, let's see what Dr. Collins thinks about this. Go ahead and hang up so you can listen.
And thank you, sweetie.
You're welcome. Certainly, she's in a lot of pain.
She's in a lot of pain. Well, first of all, it's very unlikely that that's all from osteoarthritis. Remember earlier we talked about the fact that people often have more than one kind, so it's not either rheumatoid or osteo. She may well have had both. I would, based on that history, say another thing for certain. There is something going on with her peripheral nerves, which means the nerves that run out to the ends of the limbs. In the hand, rheumatoid will cause the median nerve to be pinched and cause these three fingers to tingle, or the entire set of nerves from here out will be damaged by rheumatoid arthritis. That's called peripheral neuropathy. And peripheral neuropathy may be caused by several other conditions. She's now getting it in her feet, the tingling. So there is something very definitely complicated going on here, and I would strongly advise this patient to be seen to find out what's going on with her nerves in her hands and feet, and then to find out whether there really is inflammation causing that 24/7 pain.
So her doctor, I'm assuming a primary care doctor, says you need to see a specialist, but what kind of specialist is that? If it's a nerve issue, does she start with the rheumatologist and then go elsewhere? What would you suggest?
Well, that of course, she might end up seeing both, but I think it's fair to say that a pure nerve issue would not cause 24/7 pain that severe. Also, there's the past history of her having had rheumatoid arthritis possibly in the past. For that reason, I would start with a rheumatologist, and here's why. If, just best case scenario, she's got active rheumatoid and it's caused her nerves not to work well, the treatment of the rheumatoid can return the nerve at the wrist to health. And actually, I've, in a number of cases, had patients who were about to have carpal tunnel release surgery who had rheumatoid arthritis. Said, let's wait. We treated the arthritis, the carpal tunnel nerve tingling went away.
Wow, because you can give that nerve time to regenerate and
That's
heal.
right. That's right.
And it can make a difference.
It can make a huge difference.
Wow. Now, we've talked about remission when it comes to the rheumatoid arthritis, and there are some mindsets when it comes to treatment with any of these. Can you kind of walk me through when you're looking for whether it's pain relief, remission? What else do you do when you talk treatment?
Well, we talked about exercise in reference to osteoarthritis earlier, but rheumatoid patients get very stiff. So a fitness program for them is very important, and oftentimes physical therapists help us a lot getting those going. I think if someone also has other health issues that, for instance, prevent sleep, we all need our rest. Well, a patient who has arthritis especially needs rest. Now, as you probably know, and I hope as most of the audience knows, the sleeping medications have ended up oftentimes causing more trouble than they solve. But there are ways of helping people with sleep hygiene, and not infrequently, in fact, once a week, I find another patient with sleep apnea. So I'm a rheumatologist treating the joint disease over here, but I'm listening to a patient who's excessively sleepy during the daytime. One of my patients this afternoon drove over a yellow line twice on the way home from church on Sunday, and I set up her appointment with a sleep doctor to find out if she has a problem getting adequate sleep. So that's important. We try to steer away from the controlled pain medications because over the past 30 years it's been evident in a lot of different areas, but also rheumatology, that those medicines just don't solve any problems. If we put rheumatoid in remission, we never need that kind of pain medication.
Yeah, it can create a lot of problems actually, right?
It does.
Yeah, absolutely. We probably just have about a minute left, but as someone who is young and exercises, and I know there are others out there, I don't want to get osteoarthritis. Any words of warning or any tips of advice that you can give us?
I wish I could. The person who cures osteoarthritis or prevents it is going to win the lottery. And I think, honestly, doing what you're doing is the right thing. The osteoarthritis, especially in the lower limb, is so much worse in folks who've got weight issues.
Yeah.
So for the patients who've got lower limb concerns or back concerns, the back is number one for disability. Fitness and weight control are critical there, and also, frankly, not smoking.
Yeah,
because
quick break. We're coming back to wrap things up. Stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Sunshine, blue skies, and highs soaring into the low 80s today. You think Mother Nature got the hint that it was spring? Officially now spring, and right on time. We've got warmth, and where we've got warmth, we've got a chance for storms too. Overnight tonight, we're down to 60. Chance for some isolated showers around daybreak, but your better opportunity for thunderstorms will be Tuesday afternoon, mainly southwest of Nashville. We could see some hail with some of these thunderstorms, not expecting widespread severe weather, but it is a possibility, so you should plan for that. If you can park your car in a covered spot, That'd be your safest bet for Tuesday. Temperatures will drop behind this. This is a cold front that's coming through, so the warmth today won't be here by the time we get to Wednesday, although it won't be too terribly cold. Here's a look at current conditions in Nashville. Tonight we drop down to 60, 73 degrees tomorrow with breezy conditions ahead of the showers and storms that will come through in the evening. A few lingering showers Wednesday morning with widespread storms expected during the weekend.
Beauty and the Beast Manhunt. Next Inside Edition. The 15-year-old girl who thinks she's Belle and the 50-year-old beast who's with her. Inside the search for the student and her teacher. Then the 7-year-old boy genius.
Nitrogens, sulfur, phosphorus, hydrogen.
You won't believe what he's building. Could he be the next Einstein? Watch the next Inside Edition.
Tomorrow at 4:30 on News Channel 5.
The beauty. The kind we write songs about. Mountains rolling in like waves. Rivers sculpting the landscape. Fog so thick you can't tell where the world ends and heaven begins. Finally, a reason to put down our phones and experience a moment of complete awe that can only be made in Tennessee. Start planning at tnvacation.com.
Thank you so much for being with us on this Medical Monday, and thank you to all of our callers for your great questions. Dr. Collins, as we wrap things up, I think it's important that people know it's okay to seek specialized help.
It is, and I would want someone to see his or her internist first. But then getting seen early for inflammatory disease is the way to get it under control. This old notion of, well, I'm going to wait until I really need the strong medicine, that clearly was put out the window as a way to treat arthritis 35 years ago.
I want people to know how to find you. We're going to show the numbers right now. If you would like to see Dr. Collins, call the referral line, 615-986-6033. There's also an address there, Medical Mondays at ouradvancedhealth.com. Reach out, get some help, and hopefully you can start feeling better soon. Dr. Collins, thank you so much for being here.
You're welcome.
It was a pleasure to talk to you. Pleasure to be with you folks on this Monday night. Have a great evening.